Okay. So many little details. Okay. So Anne and Dr. Gabby. Okay. Doctor of Audiology, and they're going to hear talk to, huh?
Doctor of Audiology. I have a master's. That's
okay. Okay. And so they're going to talk to you about your audiogram. And we have one lady. Does anybody want to look at my audiogram? You want to look at an audiogram? Okay. Anne, you want to get started?
Thank you for everybody who's bearing the heat here. We will try to make this very effective and informational for you. All right, we've already known that who we are here. So what I want to talk about first is to take a look at the hearing mechanism. So we know we've been through this several times if you have been to the Hearing Well Club meetings or the HLAA meetings, but that hearing comes from both parts of our body, the left and the right. So what this shows is that we have the outer ear that collects the sound, the middle ear transfers the sound, the inner ear makes an electrical impulse, and then that electrical impulse is set up through the auditory nerve to the brain. So the sound going from the outer ear through the middle ear, those three little bones, to the inner ear, which is the cochlea, and then the message goes right up to the brain. So the left ear hears and it goes to the right side of our brain. The right ear hears and it goes to the left side of our brain, and then the two sides talk to each other. So it's an amazing system because the inner ear, that thing that looks like a snail, is the size of a pea. So if you take your fingertip and you look at your fingertip, that's how big the organ of hearing is. So the blood flow going to it is crucial. So when we have the ear, and I'm going to go, can I go back? There we go. The purpose of this whole system is only to get sound up to the brain. Okay. So that is the whole purpose, just to transfer sound. So when we say we are giving the brain information, we are trying to give it a full spectrum of sound so that it can interpret what's being said. Before I get to that slide, I'm going to go here. If I were to say to you, "Isto duma spach tiko pusta guava," did you hear me? Did you understand me? No. Ah, somebody's Polish. One person. So, and I probably said it a little wrong, but that's the only thing my grandmother ever taught me in Polish, is what I said is, "Go home and go to bed, you cabbage head." Okay? Now, you heard it, so the message got through the hearing system, but when it got to the brain, it got lost because the brain did not have the ability to understand the message that came in. So when we have hearing loss, there is a decrease in the amount of sound that's being brought up to the brain. Okay? Something is not allowing the full spectrum of sound to get through. And Dr. Gabby is going to talk to you about your audiogram and what that looks like. But what I want you to understand is when we're talking about hearing loss and a decrease of sound, it's happening. Think of trying to get a full spray of water to your plant. And if something is stopping the flow and it's not getting a full spray, your plants die. And it's kind of the same thing with hearing. If the sound is not getting all the way up to the brain, then the brain doesn't have as much information to work with. Does that make sense? Yeah. Does anybody have any questions about that right now? Yes.
Thank you. thank you for that information. If the problem is word recognition.
So we're going to talk about that in a minute of what contributes to word recognition.
Okay.
Yep. Good. So Dr. Gabby's going to talk now about the general audiogram, just to give you an idea of when you go to get your hearing tested, what are they testing and what do those scores mean?
Okay, if you guys have your audiograms, now would be a good time to pull them out so you can follow along on your own. Looking at the audiogram behind me, and for those of you on Zoom on your screen, looking at the vertical axis, the very top, very soft sounds. As we get further down, it's moving down to loud sounds. So volume on the up and down axis, top or bottom, you're looking at pitch. So very low pitches, moving up to very high pitches. That makes sense so far? Okay. Yeah, just like a piano, going up the scale of the piano. Very soft to very loud, very low to very high. On your audiograms, you will see your right ear marked by a red O and your left ear marked by a blue X. So you're looking at the response at each pitch and for each ear. In English, those low pitches are really responsible for the volume of speech, so vowel sounds, what makes speech really full. The high pitches are really responsible for the clarity of speech, so consonants, S's, TH, F's, all the sounds that make speech really crisp and really clear come from the high pitch sounds. As you're looking at your audiogram, everything at 20 decibels and above is considered normal hearing. Anything below 20 decibels is considered a hearing loss. Some of your responses might fall above 20, and then they might trickle off in the high pitches below 20. Let me go to this slide. So looking at this example here, at the very lowest pitch, that red O right on the borderline, but as we get up to the higher pitches, we see that that steeply slopes off into a more profound hearing loss. Get back here. Okay, questions on that? No? Make sense? Okay. So looking at these need help now, work with what is available. Speech sounds really are coming from about 250 to 8,000 hertz. If you fall in that normal conversational level, you might hear that someone is talking to you, but every sound they're making, you're maybe working a little bit harder to hear without hearing aids. Good? Okay, so again, want to reiterate, in English specifically, low frequencies are volume, high frequencies are clarity. So for most people, it's a clarity issue or a word understanding issue. You know that someone's talking, but every sound they're making is a little bit more difficult to understand. So when we're looking at the clarity specifically, we don't want to take a sloping line like this and just make it louder. That's not going to solve the issue. But getting very specific amounts of volume in the high pitches, getting that back up to normal is going to be the goal. Okay. This is something that your hearing aid provider might show you because this is a clear representation of where speech sounds fall. This is called the speech banana. You can see at around 250 hertz up to about 500 hertz, all those vowel sounds like we talked about. And then up in the high pitches, consonants. Different sounds are at different frequencies, and that translates to how your anatomy actually hears the sounds. So when you have a high frequency hearing loss, Most of the time, the damage in the cochlea itself is those hair cells. Damage in the hair cells reflects a lack of clarity a lot of the time. Want to talk about word understanding?
So getting to your question as far as comprehension or understanding, there's 2 different scores on your audiogram that we do routinely. One of them is called an SRT, or speech reception threshold, and that just tells us what is the lowest level that I can make the sound and you can understand the words. The more important one that is really a factor is the speech discrimination score. How well can, if we push the sound to the brain, how well can the brain understand words through the headset? Okay, so this is with no outside sound. This is just a flat sound going into your ear. So this is a more important score because this tells us how the nerve is transmitting the sound up to the brain and how the brain is interpreting the words. Okay, so this score on your audiogram is very important. Another score that is very important, oops, did I push the wrong one, is your quick SIN score, SIN, which stands for sentences and noise. Not all providers give you a quick SIN score. As an audiologist who follows best practices, I could not do a hearing test without doing this, because this is how we stress your system. This is how we find out when you get into background noise, at what point does your brain break down? Okay, we all break down in background noise, but we want to know at what level that happens at. So you might have 100% or yeah. How do I get that off? There we go. You might have 100% or 88% in quiet, and you think, okay, I have pretty good understanding. But when I start to apply background noise, your score might drop significantly. And so as you get your hearing tested, you need to understand that that quick SIN score is very important. And the reason it's important is it tells us as hearing care providers what are realistic expectations for you. Because if I don't stress your system, I have no idea how well you're going to do in real life, because we don't live under headphones, right? We live where it's noisy and we need to know what's happening. When you find out your scores, your discrimination score and your quick SIN score, then you can use that information to set some very realistic expectations. What does that mean? It means for the majority of you who are here at this meeting, your understanding score is probably in the fair to poor range, some of in the very poor range. And what does that mean? It means the sound is going up to the brain, but the brain is not understanding the message. And it's not something wrong with your brain. It's just the way the ear is damaged. It's not clear. So when we see a score like this, then we know you might need some assistive devices. You might need to really focus in on lip reading. You might need to only go to places that are looped if you really want to hear at a meeting. It really helps to know what your speech discrimination score is, and then what your quick SIN score or your score and background noise. I am making a mess of this. Okay, how to get rid of that. There we go. There we go. Oh, there you go. That one. Okay. So Dr. Gabby is going to talk about different types of hearing loss. I really we're just going to push through this because the majority of you have the nerve loss, but she just wants to show you that there are different kinds of hearing loss.
Okay, so we're going to skip ahead to conductive hearing loss. Going back to the picture of the brain, If there's an issue with the outer or middle ear full of wax, fluid in the middle ear, issues with the eardrum, looking at your audiogram, you're going to see a good response through bone conduction, but a poor response through air conduction. So as we give you the tones and you're clicking the button or raising your hand, when I send the signal through the middle ear into the inner ear, we're seeing a hearing loss. Yet when I bypass the outer middle ear, directly stimulating your hearing organ, we see better responses. Sometimes it is both an issue with the outer or middle ear and the inner ear. This is an example of what's called a mixed hearing loss. That could be a permanent hearing loss from the nerve due to noise, and then currently you have a middle ear infection. But for the majority of you, you're dealing with something called sensory neural hearing loss, and that is permanent hearing loss coming from damage to the cochlea, the nerve itself. You can see here the bone conduction scores, so the little Pac-Mans line up exactly with your X's and O's, meaning that outer ear, middle ear, everything is okay. Damage is coming from the inner ear. Question from Tony. Yes, she just wanted to reiterate, red O's are right ear, blue X's are left ear. So we not only want to know the function of how the ears are hearing and understanding, but we want to compare the two ears as well. Yes. Yeah, she also mentioned on your hearing aids, red right, blue left. Most hearing aids, doesn't matter what brand, where you got them, who you got them from, red right, blue left. They kept something simple for us, luckily. Questions on the different types of hearing loss? No? Close it out.
So the question is, why does it matter, right? Why do you need to know this information? Because as Tony says, an educated person hears better, right? When you know what is happening in your ear, you understand why it's happening, you can set realistic expectations for solutions. People will come in and say, the hearing aid isn't working. I still can't hear in background noise. Okay, well, it can be that the hearing aid might not be set right, but it's probably that the nerve is not sending the message up to the brain. The brain is just not interpreting the words well. Because I can take that hearing aid and put it on somebody who has less hearing loss, and they hear extremely well in noise. The problem with background noise is that naturally in our head, our brain has an ability to lift speech and push down noise. That's how we can hear and be eavesdroppers, right? So what is an eavesdropper? An eavesdropper is somebody who's looking this way, but I hear Dr. Gabby mention my name. I'm going to tell my brain, listen over here. It's not an ear problem. It's not an ear issue. It's a brain thing. I tell my brain what to focus on. And when you have hearing loss, physiologically, the brain does not have the same ability to filter the background noise. So what the hearing aids are doing today through artificial intelligence is they are recognizing, oh, that speech is a spiky signal. She probably wants me to elevate it. Oh, that background noise is steady state. You want me to repress it. So the idea is that the hearing aid is doing everything it can to lift up the speech and pull down the noise. But for many of you, especially here in this room, that isn't enough. And that's why we have assistive devices. so that you can push the voice or make the speech louder than the background noise. I know it's not an easy system sometimes to use, but it can be an extremely effective one. Is there questions about that, of which we've talked about? Yes, let's go here. Hold on 1 second. Let's wait for the microphone.
When I use the lower the volume in a crowd, I lose the hearing. The hearing also goes down. So I either have to choose one or the other.
Yep. So what's happening is you are correct. When you lower the volume, everything goes down. There are a couple programs that can help. One of them is how the hearing aid is programmed, like to take loud sounds and bring them down in the software by your provider. So they can work to try to make some accommodations for you. But the biggest issue is trying to get the speech louder than the noise. And the best way to do that is through accessories. Like Randy has one on. He's got a microphone.
Oh, yeah.
Have you tried any kind of accessory?
Pardon?
Have you tried any kind of an accessory with your hearing aid?
Mm-mm.
Okay.
No.
One of the other things that's helpful is trying to learn how to do some lip reading, how to do speech therapy, and trying to get information off of people's faces. So that is something we all do, is we do lip reading naturally, but there's a skill behind it. And we also have a speech pathologist who offers oral rehab classes that we can tell you about if you're interested. But what we're looking for today is to get you educated so that you understand why your hearing aids don't seem to be enough. Other questions? Edna, do you want to talk about your microphone, your sound assist? You didn't bring it, that's okay. You've got the T-coil in your hearing aid, but Edna has a microphone and she is very happy with it. If you want to talk about how you use it and with your son.
Well, my family is very happy with it. In fact, when they come to visit, they don't give me a hug. They go pick up the sound assist, put it on, then they give me a hug, so that they can, and they don't have to talk extremely loud. I'd still rather face them so that I can lip read. But the whole idea of communication has gotten so easy for us. It's just, I still have trouble in a meeting, but I think that's because of how the meeting is arranged and things like that. And I'm still learning how to use it. But it is a blessing. It really helps. It really does.
And so what she's saying is the reason that helps is because the microphone is making the speech louder and the noise lower. It's making the voice come through better. And that is one of the main reasons that you struggle so much, is because the background noise overpowers the clarity of speech naturally. And when you have a hearing loss, it's twice as bad.
Also, I told my family, be careful what you say when I leave the room, because I can still hear you. Or if you go in the other room, I know what you're saying. So, it is really an exceptional
little device.
Yes,
Yeah.
right.
Good. Other people, do you have questions about your audiogram? Yes.
I'm not, my audiogram doesn't seem to jive with the one you had up there, but my question follows up on the microphone. On the microphone that you mentioned, I have a microphone that someone can wear around their neck or clip onto their shirt or top.
Correct.
The problem, and it's useful, except when it rubs and makes noises and all of that. It rubs against the shirt, gets very annoying, especially when they scratch a lot while they're talking to you, you know. The problem is that it only works with one person. Mine only works with one person. So if I'm with more than one person, then it's basically useless. So I'm just wondering, is yours for one person?
Well, you got to give her the microphone.
So it's multiples.
No, I lay this little device on the table, say the coffee table, and everybody's in the front room, and I hear everybody because it's got 4 little microphones when it's laying down. And when the person I'm talking to is wearing it, just one microphone is on. So
So the one she has a gyroscope in it. So it knows that when it's laying flat, all the microphones are on. When it's tilted up, only one microphone is on. However, it's still not really made for that big restaurant environment. Okay. Some people use it and they raise it up off the table and they will put it on a glass, but it's not made for that. So it goes back to having some, quote, realistic expectations, right? So if you go to a restaurant and I put the microphone maybe on Gabby instead of me, you might hear me on the side, but you would have a good conversation with her. The idea is leaving and going home with a good conversation with 1 or 2 people is a whole lot better than sitting like a bump on a log through the whole night, right? So the whole idea is understanding realistic expectations and then trying to maximize that expectation. Does that make sense? Sarah, does that make sense? Does that make sense? Yeah. She said, sadly, yes. Part of it is when you say that they're scratching, the microphone should always be facing out. I don't know what brand you're using, but if the microphone is facing out, you really should not get a lot of clothing noise from the microphone. So we might look at that microphone. Other questions or comments? I know Tony wants.
I've got a question. I'm calling in. Is it all right if I ask the question?
Yes, of course.
Hi there. I'm going to try to go on video here. Hi there. Thanks so much for your presentation today. I'm a 49-year-old professional female, and I've worn hearing aids for the past 20 years. My most recent audiogram shows much more significant loss than the last test that I had. And my my sound discrimination score is 60%. What I'm finding is that I'm struggling more significantly in business environments, whether it's one-to-one meetings or in group sessions, not necessarily a restaurant environment, but a professional environment where it's quiet, but there is conversation happening from different parts of a room. I expect to work another 15 to 20 years. Is there some more powerful device that I should be seeking, like cochlear implants or something that would help with improved hearing?
You're only utilizing a hearing aid at this point, correct? No accessories?
That's right.
I would say, cochlear implants, pretty extreme jump. I don't know that you're there yet. I don't know your hearing loss, but those accessories like the microphone we were talking about, very helpful for my working patient. And actually the meeting room environment where there's maybe 4 or 5 of you around a table, multiple, speakers, but fairly quiet is actually a really ideal situation for something like a table microphone. So I would talk with your provider, talk about partner microphones, table microphones, maybe looking into something like hearing therapy or oral rehab to work on the side. The hearing aid and the accessories are going to do their best to get your ear and your system the access to the sounds, but then your brain needs to know what to do with the sounds. So taking extra help with context clues and lip reading, plus the microphones, I think will just give you more, better equip yourself for the working world.
That's helpful. Do you have a few brands on microphones, or is that something that I should work directly with my audiologist for?
With your audiologist, because it is specific to manufacture. So we're talking about Edna's microphone that can be either a partner mic or a table mic, whereas Sarah, I don't know that yours has the option to be a table mic, and that's based on the hearing aid manufacturer themselves. So
great. Thank you. That's very helpful.
Yeah. Widex Sound Assist is the one that we were talking about that does both table and partner. Most other manufacturers have something similar, but that's the one specifically Edna was talking about.
Excellent. Thank you.
You're welcome.
I also wanted to give an example of what this young lady was talking about. Is I recently fit somebody with a severe, profound hearing loss. So if you think her hearing loss is at the bottom of the scale, but she works in finance at an auto company, and she had to have closed captioning on every call, and she would sit to the side and another woman would be her ears for her because she wasn't sure if the closed captioning was accurate and if she was getting all the information. We recently fit her with the Sound Assist from Widex, and it has totally changed her life because now she can participate right in the meeting without having the interpreter with her. So I would strongly recommend the partner mics as an accessory that you might consider using. And we do give classes on how to use them for almost any manufacturer. Randy?
Thank you. That reminds me of what you're talking about. I will tell you, you'd be amazed about how unselfish people are in regards to using this device here and want so they just love it. People love it. People I talk to, in this room here, there's a camera club. So I joined the camera club. And I've gone to several meetings, and John, Jack said, "Give me it. Come on, let me have that." Because he really wants me. He just loves the fact that I can, hear the clarity of what they're talking about. And there was a time I didn't do that. So anyway, so it was a real good presentation. They were talking about this man had gone to Ethiopia, and I was able to kind of, this room here is easier to understand. But then I just talked to Gabby earlier. I was just taking a gym class, and I would not be able to do it. If it was not for this device right here, no way could I do that. I could understand some of the other conversations. And then I heard in one conversation, she forgot to turn it off. Woman said, I have taken off about 50 pounds. I now weigh 217 pounds. Oh, okay, good. I didn't go up to her and say, I heard you. I was not that kind of person. But she knows she was smarter now about to turn her off. Okay.
Yeah. So Randy, I don't know if Zoom could hear great on that mic, but Randy was saying people are really helpful. They want to wear the device if they know it's going to make an impact. And like Edna was saying about her family, now they are rushing to put the microphone on because it can improve really signal to noise ratio and in turn your understanding.
And there's things that you can do through the app on those devices to make it even better. But I wanted Gabby to put this audiogram up here because Randy, with his hearing loss, up in the high frequencies where we see it way down, his is gone. He doesn't have anything out there. So he doesn't get any clarity. So he's totally relying on lip reading and volume of sound to try to get the message. He doesn't hear the difference between ship and chip, shoe and chew. But when the microphone is on and he's got the visual cues, then he can participate. He still might make a mistake here or there, but he's in the game. And so what he's talking about is his instructor at the gym wears the microphone, he's in the back of the class, and he can still participate.
The lady you were talking to, she'd like to share her screen and show her audiogram. Okay, Alan, would you give Lisa May access to share her screen?
It's still showing disabled, but maybe it's just another moment.
Oh, we have to stop sharing here. Hold on.
Okay. Thank you.
Never done this before, so. Okay. Do you have access to share a screen now?
Okay, it should be coming up. Not quite yet.
No.
Okay, try now.
Okay, we'll try again. That works quite well. Thank you. Give me one moment and I will get my audiogram shared. Thank you very much. I appreciate the opportunity. All right. Can you see that on the screen?
Yes, we can. Yes.
My left ear obviously is my better ear, and I have, and I rely on it pretty heavily. But otherwise, they're not overlapping, obviously, but you can see the difference in the gray is my last audiogram and the red or the blue is the current audiogram. And so there's a fair amount of loss that's happened. And particularly in my right ear, I struggle significantly. In an audiogram like this, are some of the assisted devices, such as the microphones and whatnot, would those be types of supporting devices that I could be expecting? I think it was the listening assist or yeah.
Yeah, absolutely. So you have a tough loss because you do okay in those low pitches and then very steeply sloping down in the high pitches. So for you, just taking this and raising the volume is almost like turning up a broken speaker. You're going to get some distortion. You'll hear a lot of sounds that we're not necessarily focused on. So with something like the partner mic, it's not just raising the volume, but it's really focusing on the speech that you do want to hear. That way we're not turning up all the extra stuff you don't want to hear. Another thing right now I see you're wearing headphones. There are different devices that can connect you to your computer. That way, through the hearing aid, the sound coming out of Zoom goes straight to the ear. That's another good option to really focus on the clarity of speech, not necessarily the volume of speech, which in your case is really what we want to focus on.
That's right. My audiologist did say that I should set proper expectations about the quality of my hearing over time. Would that be consistent with what you would expect seeing an audiogram like this? That I just need to be realistic, that it's going to be hard to hear consonants and hear the differences between shoe and really making sense of it?
I think that knowing that you have, pretty significant hearing loss is obviously step number one. We have to accept that. Knowing that what we can give you with all the tools is never quite like your natural normal hearing. But knowing that, equipping yourself the best you can, handling what you're in control of is really where your focus should be. If you're looking at your speaker, gathering context clues, plus wearing the best hearing aids you can, fit appropriately with these accessories, it's not like you're going to miss out, just knowing that it might never be perfect.
Excellent. Thank you. Thank you again. I appreciate the
Thank you for
opportunity to share
sharing.
this
This
out.
is a great example of exactly what we were talking about with sensory neural hearing loss specifically.
Thank you.
Lisa, the one thing I would ask is right now you are taking the Zoom call through a standardized headset. You're not using your hearing aids. Is there a reason why?
I have hearing aids in and I have the earbuds in. It's sort of doubling up. Yeah, my hearing aids actually don't have Bluetooth.
Your hearing aids don't have Bluetooth?
Do not. That's right. Yeah.
Okay. Because when you're putting the AirPod in your ear, the microphone for the hearing aid is on the back.
Okay.
Wondered what kind of clarity you're getting from that setup.
Yeah.
Ways to do that.
Yeah, I do lip read quite extensively. I've had hearing loss. It's in the family. Family gatherings are quite fun, right? No one really hears all that well. So, but I've been reading lips. So the contextual piece of that, I can really appreciate, as you both are suggesting, that context is so important to help string along and come along in the conversation.
For sure. That's wonderful.
Yep.
Thank you for sharing. Does anybody else have any questions or comments that they would like to talk about? No? It's pretty warm. We do. For those that are here in the room, we have cookies in the back. Oh, we've got a question over there.
Okay. The one thing I wanted to say, yes, I'm coming, Herlinda. One thing I wanted to say is when you have an accessory, like a partner mic or a table mic, that sound is processing through your hearing aid. So you only can use the accessory that matches your hearing aid. So if you have a Widex hearing aid, you need a Widex microphone. I don't know if that was clear before. If you have an Oticon hearing aid, you need the Oticon accessory. So, okay.
I have a question that's a little different than the topic. Is insomnia related to hearing loss?
Insomnia. Tinnitus is related, which could cause issues, but I don't really feel like insomnia is related to hearing loss.
Do you have ringing or buzzing in your ears?
No.
Do you find that you are more anxious because of your hearing loss? No.
No.
Then
Aging.
part of that is getting a little wiser, just like hearing loss.
The reason I asked, I went to a different meeting and the audiologist mentioned insomnia and hearing loss, and I've never heard that before.
Yeah, I would say that would be more directed towards anxiety related to hearing loss or tinnitus specifically. I've not read or seen anything directly linking the two, but we know that hearing loss can negatively impact cognition overall, and that impacts everything. So, you know, I'm not surprised if there is literature quoting that.
Well, that's good to know. There's a lot of other things that relates to hearing loss.
Totally. And everyone's so different. So, you know, it's not off the table. Another question?
Another question over here.
My question is, as people get older, the breakdown is in the nerves in the cochlea. Is that where the breakdown is coming because of age related?
Yes. So I always joke that getting a little wiser with time can bring on some high frequency hearing loss. That goes to kind of how the anatomy and physiology of the cochlea is itself, where the high frequencies are inside of the cochlea is right where the fluid of the inner ear seems to shear off those hair cells the most. So oftentimes with age-related hearing loss, it starts in the high frequencies and maybe slowly creeps down that graph.
Okay. In my particular case, I was born premature due to the RH factor, and the cochlea was never fully developed. So
Gotcha.
over time, my hearing loss hasn't really changed. I'm 76 years old,
Okay.
so I don't expect to see the cochlea changing anything since it was never fully developed. Is that
Right.
correct?
Correct. So any hearing loss in the cochlea itself is considered a permanent hearing loss.
A permanent hearing loss. So
Correct.
I won't see any changes in my audio.
Probably not. The worst part about my job is I can never really say why, when, or how a hearing loss happened. You're rare that you kind of have an idea, but I also don't have a crystal ball, so I can't say
Yeah,
what's
right,
gonna
right.
happen.
Right, yeah.
Yeah.
So nothing's really changing, yeah. Okay.
Which is
Thank
good.
you.
Yeah, you're welcome.
Thank you.
Any other questions on Zoom or in the room? No. Oh, one more back in the back.
Okay, I'm coming with the microphone. Here I come.
And before she says her question, an answer with age-related hearing loss, think of it like a room. If I walked into the room, even if I'm going to the bathroom, but I have to go through the living room, I'm going to see the rug worn more than in the bathroom. It's the same thing. The high frequencies are the first area that gets stimulated in the inner ear, so they go down quicker. I hope that helps.
Yes, hello. I'm inquiring about having an operation on the ear. Is that very serious? I mean, I know it's serious, but is it successful if you have the operation?
What kind of operation on your ear?
For cochlear?
You mean a cochlear implant?
Yeah.
So a cochlear implant is still dependent on the nerve. I don't know, we stopped sharing. So with a cochlear implant, what we are saying is that the cochlea, or the piece that looks like the snail, is damaged and is not transferring sound well up to the brain. But the assumption is that the nerve still is intact, so that if we can get to the nerve, we can send the sound up to the brain. Sometimes it's successful, sometimes it's not. But before you get to the point of a cochlear implant, I would suggest you do the therapy of cochlear implant and see how much success you get, because you're setting yourself up for success by doing some of the therapy first, which is lip reading, because you have to learn to hear sound all over again with a cochlear implant. Tony, you've had a cochlear implant.
A question in chat that Dr. Debbie is going to.
So in the chat, they asked, are there successful cases of individuals receiving cochlear implants late in life? And what are the criteria for receiving a cochlear implant as an older adult?
So what I'm going to say is that I don't want to cut you short, but that's not the topic of the meeting right now. Tony has people talking about cochlear implants. And I mean, we're going to open a whole door of Pandora's box of cochlear implants, because there's pros and cons. Tony has a cochlear implant. Several of the people in this room have a cochlear implant. And I think that that's another discussion. I'm not avoiding the question. I'm just trying to be cognizant of our time and what's happening here.
So I'd like to say that in my 26 years of dealing with people with hearing loss, I have known people in their 90s to get a cochlear implant surgery. As a matter of fact, one lady I know got one in her early 90s and one in her mid 90s. And a lot of it has to do with how are you health-wise otherwise. So there, do you have any conditions that you wouldn't be good for surgery? So it really is, anybody that's looking at getting a cochlear implant will visit a cochlear implant audiologist for the specific test required. that are needed to determine if you can get a cochlear implant. If you pass that, or if you fail that and they say, yes, you should get a cochlear implant, you will then see the cochlear implant surgeon. You will have blood tests. You'll be examined otherwise. So nobody gets a cochlear implant just because they say, I want one. And again, in all my years of dealing with people with hearing loss, I have known people in their 90s to get a cochlear implant. And I want to say, save the date in November. We're going to have all three cochlear implant companies here in this room or on Zoom. Some of them may be here, some might be on Zoom, and they're all going to bring a recipient. So they will have a recipient representative as well as a cochlear implant manufacturer representative. So there'll be Med-El, Cochlear America, and Advanced Bionics will all be here in the month of November. So save that date. I don't know, whatever the second Monday is in November. I don't have the date in my head. Okay. All right. So I hope you'll come. Yes. Okay. Now the lady behind you, I was the one who's thinking about getting a cochlear implant. And if you want to talk to me about mine, I'm willing to share. All right. Thank you all for coming. It's been horrible heat out there, and we all survived it. I think it's 88 degrees in this room. You're all doing good. Thank you for coming. And Anne, thank you so much. Dr. Gabby, thank you. Yes. And hope to see you next month when we talk about traveling.